In a world where appearance often feels like everything, countless individuals seek the solution to receding hairlines and thinning crowns. But when it comes to hair transplants, does the saying, "you get what you pay for," hold true? Today, we're diving deep into the world of hair restoration, from budget procedures that promise results at just $1,000 to luxury experiences that can set you back a whopping $50,000. Whether you're considering taking the plunge or simply curious about the journey of transformation, we'll uncover the real differences, the myths, and the truths behind these price points. This is the $1,000 versus $50,000 hair transplant showdown. And this is the scale that we'll be using to rate the results. It goes from needs improvement to exceptional. Our first case is a $1,000 procedure from Turkey. This was a case of about 2,000 grafts performed via FUE technique. When I look at these images, what I see is that there's a nice hairline design. The hairline was not placed too low. As I've said in many of my other videos, you have to be careful about placing the hairline too low because it can be difficult to then build up enough density to account for further thinning that can occur further back on the scalp. I think this procedure really helped reframe the face for this gentleman. When I look closely at the hairline, as I look at the frontal few rows of hairs, I am seeing some heavier grafts at the hairline. And that's something that should be avoided because when you're trying to create a natural hairline, what you see in most hairlines is that you have these kind of finer, wispier hairs in the first few rows, and then it gets into the heavier grafts. So if those heavier grafts surgically are placed right in the front, it gives it a less natural type of appearance. The other element that I'm seeing here is that when you look on the left side of the hairline, the frontal inch lacks density. When you're creating hairlines, you want to make sure that that frontal inch gets solid density and that it gets prioritized over areas that are further back. The overall rating for this case is good. Now let's take a look at another procedure. This one also cost about $1,000 and it was also performed in Turkey. The graft count here is unknown. First off, let's discuss the design of the hairline. Even to me, the marker that was used is a bit too thick. The overall width of that blue line is probably about 1 centimeter. So you have to decide, is the hairline going to be right in the middle of that blue line? Is it going to be towards the top or towards the bottom of the blue line? Where you place it along that blue line is going to give a very different appearance. So that really isn't the most ideal way to mark things out for a hair transplant. It's much better to use very small dots along the hairline or a fine-tipped marker that's much more accurate. To me also, the design shows that there's a bit too much medialized recession. So when I create a hairline, I like to create that rounding that goes into the temple a bit further lateral than where I see it created here. And this could be a personal preference, but it's not the way that I prefer to design hairlines for my patients. Now, when you look at the density that's been created with this procedure, it's clearly low. So either too few grafts were transplanted or the survival of the grafts that were transplanted was not great. Either way, the area clearly lacks density. Now, in looking at the direction and angulation of the hairs, to me, it does not follow the natural hairs. I think that the hairs here are sticking up too much. They should be at a bit more of a flat angle. At least that's what I see when I compare it to the angle and direction of his original hair. And also at the hairline, there isn't enough irregularity. In creating hairlines, you definitely want to maintain a general shape, so you need to have some structure built in. However, you need to irregularize the hairline enough so that it looks real. And because of all these stated points, I would put the rating here at a needs improvement. Now let's get into $5,000 hair transplants. This first case at the $5,000 mark comes from Turkey, and it's a 5,000 graft case with FUE. Now this to me looks impressive. There is significant improvement for a patient who is a near Norwood 7. And there's clearly good conservative hairline design that was implemented. And that really is what set the stage for this result. If they placed the hairline too low and too flat, they would never have been able to build up this type of density and it would have looked off. But this case was properly planned designed, and executed. The hair is being combed over in the after image, so it's hard to exactly tell density, but overall, this is a nice result considering the starting point. And this is just a reminder that I'm not a fan of mega sessions when it comes to FUE. So 5,000 grafts in one session is a lot, and that could potentially lead to over-harvesting and poor donor scarring. And again, with these images, we're a bit limited in the assessment of the donor area, so we're not able to say how the scarring looks in the back. But my overall rating here for this case is great. Now let's take a look at another procedure that was done for $5,000, also out of Turkey, with 3,900 grafts. For nearly 4,000 grafts, I don't really see much change, and it actually looks like it might be worse post-operatively. Now, the reasons for this might be due to poor survival of the grafts, but it also might be because of lack of medical therapy. Oftentimes, people go into a hair transplant not knowing or not wanting to do any kind of medical therapy, and so if you continue to thin out even the course of the year post-op, then when you look at the results of your surgery at a year, you might be worse off than where you started because of the continued hair loss from just natural aging and the androgenic alopecia process. I always tell my patients that it's important to stabilize your hair in advance of surgery. And often this stability is achieved with medical therapy such as Finasteride and Minoxidil. To find out more about these medications, head to feelconfident.com. My rating for this case is needs improvement. Now let's look at a case that was about $7,500. This procedure was done in Canada, and it involved 846 FUE grafts. That's quite specific. Considering the number of grafts, this was under 1,000 grafts. I think that this case shows excellent survival, really fantastic direction and angulation of the hair, and the density created looks great for under 1,000 grafts. And he can always come back to that clinic or somewhere else for a small touch-up procedure. But this to me looks like a great result. One note here is that I do like to see consistency in the before and after images. And this is in terms of the hair color, the length of hair, the lighting conditions, and the background that's being used. But keep in mind that this isn't always possible for logistical reasons. Some patients travel in from far away, they can't always come back to the clinic where they had surgery, so they might email in photos. And of course, those are never going to be quite the same as the photos that were taken in the office. My rating for this case is exceptional. Moving on to $10,000 hair transplants. This case was done in Greece, and it involved 5,100 FUE grafts. There is a significant density improvement here. That, to me, is obvious. When you zoom in at the hairline, there is a slight plugginess appearance to it. And the angle at which the grafts were placed right at the hairline, to me, appear that they're not acute enough. You can see in the preoperative image how the hair lays fairly flat. And so when you do the procedure, you need to make sure to recreate that type of appearance. So my guess is that right in those frontal, 4 or 5 rows, the hair is most likely at about a 30-degree angle at most for this patient. But to me, the way that it was transplanted appears like it's a greater angle than that. And also finer hairs are needed at the frontal few rows to give it a very natural type of appearance. You want the finer hairs to then blend into the heavier hairs further back. I give this procedure a good rating. Next up is a $25,000 procedure out of Canada, and this involved over 8,000 grafts using the FUT technique. This should serve as a reminder to all of us of how powerful FUT surgery is. It can truly generate an incredible yield of grafts compared to FUE surgery in a single session, but also over time as you do several procedures. As many clinics move away from FUT surgery to doing exclusively FUE procedures, and especially men seek out the FUE techniques, a lot of times what can be created with FUT is forgotten, but this is a nice reminder. And so in addition to the density that over 8,000 grafts brought in, there's also a natural hairline that was created here, both macroscopically and microscopically, and that really is impressive. The immense improvement that this patient shows is undeniable, so my rating here is exceptional. Now let's look at another $25,000 hair transplant, this time from the US, and this was about 2,600 FUE grafts. grafts. In my opinion, this is very nice restructuring of the hairline. I see overall good density that was generated, and remember that curly hair is more challenging to work with. It's both harder to harvest because of the curvature of the hairs beneath the surface of the skin, and also it's harder to implant because you have to follow that curvature. So that's what makes it just overall more challenging to work with curlier hair. But on the flip side, each hair goes a longer distance because it starts to curl, and so it has better coverage compared to a finer straight hair. So the appearance of what you create with, say, thinner, straighter hair of maybe 2,500 grafts might equate to what you get out of 2,000 curly hairs. My one critique of this case is that as you look at the hairline laterally, as you get closer to the temples, there is a dip that occurs right around the connection to the temple. Now, this might be how the patient wanted their hairline designed, but to me, there is a reduction of naturality that at least hits my eye. So I give this case a rating of great. And now let's look at a $50,000 hair transplant. And this one was done in Canada with over 9,000 grafts with FUT technique. This $50,000 result again shows the power of FUT surgery. But most men in my practice don't even want to consider FUT because of the linear scar that it leaves behind. But maybe the pendulum has swung too far towards FUE surgery, and perhaps we should bring back FUT in the right scenario. One critique that I have for this incredible result is at the central hairline. To me, it looks like it could be more dense and less flat appearing. And I would prioritize that central frontal area over the desire for incredible scalp coverage. My rating for this case is great. In the world of hair transplants, a high price tag isn't always synonymous with top tier results, nor does a bargain guarantee disappointment. It's the surgeon's artistry and expertise that truly counts. Choose wisely, prioritize safety, and remember, your head is the canvas and you want the best artist to craft your masterpiece.